If you're watching this, you're probably in a really hard place. You might be asking, how do I know it's a time? And the truth is, you are not alone. This is one of the most painful decisions any pet owner can face, and I want you to know something right away. You're not giving up. You're trying to do the kindest thing, and you want clarity. In this video, I'm going to walk you through how to assess quality of life in a practical way, and the difference between the bad day and it's a time, signs a pet may be nearing the end, and what's urgent, what euthanasia is actually like step by step, how to keep your pet comfortable at home, what happens after, including aftercare choices, and how to cope with the guilt and grief, because this part is real. I'm a vet, but I cannot diagnose your pet through the screen. If your pet is struggling right now, especially with breathing, collapse, seizure, or uncontrolled pain, please contact your vet or emergency service today. Okay, let's do this gently and clearly. Question, how do I know? Is it the time? Usually hides three deeper questions. Are they suffering? Can we realistically fix or manage it? If we can't, what would be the kindest exit? Quality of life isn't one single moment, it's a pattern. So here's the simplest way to think about it. If your pet's life becomes mostly enduring rather than enjoying, that's when we need to talk. Let's make it practical. I use a few core categories. Number 1, comfort and pain. Can your pet rest comfortably? Can they change position when they cry? Do they look tense, hunched, withdrawn, or restless? Number 2, breathing. Breathing should be quiet and easy. If breathing is labor, rapid at rest, or your pet looks panicked, that's major quality of life issue. Number 3, appetite and hydration. A pet doesn't need to eat the banquet, but they should have some interest, and they shouldn't be consistently nauseous or unable to keep food down. And number 4, toileting with dignity. Can they get to the litter tray? Can they squat or posture comfortably? Are they so weak that they repeatedly soiling themselves and distressed by it? And number 5, mobility. Can they get up? Can they move to their favorite spot? Can they go outside or to the tray without fear? And number 6, joy. A lot of pets nearing the end get anxious, especially at night. So try, keep a predictable routine. Use the nightlight for all the pets who are confused. Produce quiet companionship. Soft bedding in a warm, draft-free place. Sometimes anxiety needs medical support too, and your vet can help. Comfort care isn't doing nothing. Comfort care is medicine. It's just focused on easing suffering rather than chasing a cure. And that brings us to the part many people fear most. People often ask me, will they feel pain? Will they be scared? Will they know what's happening? Let me explain what's usually like, step by step. Euthanasia, when done properly, is intended to be peaceful and pain-free. The goal is to prevent suffering, not to create it. There is 2 common approaches: clinic euthanasia and at-home euthanasia, where it's available. Both can be kind. The best choice is the one that keeps your pet most calm and comfortable. Now, the usual steps. Step number 1, settling in. We try to give you time. We talk you through what will happen. You can choose where your pet is most relaxed: a blanket, a lap, or a floor. You can bring a favorite blanket, you can bring favorite treat if they're still eating, or a toy, and the people who matter if it's calm for your pet. Step number 2, sedation in many cases. For many pets, we give sedative first. This is to reduce anxiety and discomfort. It usually makes them drowsy, relaxed, and sleepy. Some pets still look around, some sign, some snore. It varies. Sedation is an injection under the skin or into muscle. Your pet may feel a small prick, similar to vaccination. Then you wait a few minutes while they drift off. And then we've got step number 3, which is the final injection. Once your pet is deeply relaxed, the final injection is given, typically into vein. This medicine acts quickly. Your pet passes away gently, often within seconds to a minute. They do not suffocate. they don't experience panic when done appropriately. It is more like going to sleep and then the body stops. Things that can happen that they are normal. This is important because some normal body reactions can be alarming if you're not prepared. Your pet may take a few deep breaths, have small muscle twitches, urinate or pass stool, keep their eyes open. Those are reflexes. They are not signs of pain or fear. And if you choose not to be present, I want you to hear me. That does not mean you love them any less. Some people cannot cope with that moment, and that's okay. Your pet can still be held, spoken to softly, and cared for with dignity. Aftercare is something people often don't think about until the last second, and then it feels overwhelming. Common options include individual cremations. Your pet is cremated alone and ashes are returned. Communal cremation. Your pet is cremated with others and ashes are not returned. And home burial. This depends on the local rules and practical considerations. Pet cemeteries and memorials gardens in some areas are also available. If you're considering burial, please check local guidelines and think about depth, location, groundwater, and access. Many owners find comfort in small memorials. A paw print, a clipping of fur, a photo frame or memory box, planting a tree or flowers in their honor, or donating to the animal charity in their name. There is no correct way to do this, just what it feels right for you. Now the part that hits people the hardest, the guilt. Did I do it too soon? Did I wait too long? Did they think I abandoned them? Did I betray them? Let me tell you what I see over and over again. The people who worry about doing the right thing are usually the people who have loved their pets deeply. Guilt is often the grief wearing a mask. And here's the truth, it may help. Your pet doesn't measure life in years. They measure it in safety, comfort, and love. A peaceful goodbye in your arms with dignity can be one of the greatest gifts you ever give them. If you are stuck between too soon or too late, ask yourself, are we still having more good days than bad? Are the bad days recoverable, or do they keep stacking up? Are we managing comfort, or are we chasing suffering? If my pet could speak, would they ask me for more time or for more peace? If you are going through this right now, I'm truly sorry. And I'm also proud of you for facing it with love. And if you found this helpful, subscribe to DrVet for calm, honest pet advice. Take care of yourself and give your pet a gentle cuddle from me. Take care.